Hey there, this is Dr. Evan Osar. Welcome to video 3 of this series, Best Core Exercises for Individuals that have low back pain. Recall that in videos 1 and 2, and if you missed those, make sure you check those out because this video will piggyback right off the information contained in those 2 videos. Recall that in video 1 we discussed the biggest myth surrounding exercise and low back pain. Individuals are too frequently told that they have a weak core. And over 17 years in practice and dealing with thousands of individuals with low back pain has taught me one thing, that most individuals do not have a weak core. Because then otherwise we would see that all individuals that are in the gym and strengthening would not have low back pain, and we see that that's just not true. And most individuals have a non-optimal strategy. And in video number 2, we looked at our most important assessment for determining whether or not somebody has a great strategy or core stabilization strategy. In this video, we're going to carry that into what do we do to actually train the core in our clients. And the most important concept I want you to take home from this video and this video series is there's not one best exercise. The best exercise for your client or individual that has low back pain is the exercise that allows them the best opportunity to maintain alignment, breathing, and control. Because when you maintain alignment, breathing, and control, the individual can move and exercise in a manner that facilitates the proper movement patterns, meaning that they can move the way the body's designed to move. If they compromise alignment, breathing, and or control, they will start to develop compensations, and that's where the majority of low back pain comes from, meaning from a structural standpoint. Most structural low back pain comes from non-optimal alignment and or non-optimal breathing and or non-optimal control. So what do we do with our clients once we've taught them optimal alignment, breathing, and control? Then we take them through all the fundamental movement patterns: pushing, pulling, squatting, lunging, bending, rotating, and then eventually gait training. But one of the patterns we like to use, and people will always ask us, what do you do to train the core in your clients? Well, we use a variety of patterns. We love chop patterns, for example. So chop patterns are great patterns to teach and reinforce the optimal alignment, breathing, and control. So how do we set up the chop pattern in our clients? This is even good for our clients that have low back pain once they understand the proper alignment, breathing, and control they need. So what we're going to do is take a stance just a little bit wider than shoulder width apart. We're going to grab the handle with our opposite hand away from the machine, and now we bring the cable in front of the body. Now what we're going to do is the first movement is a weight shift. So we've already taught the client how to weight shift. So this is not a pattern we start out with. This is how we progress them into a more functional type pattern. So now from here, the shoulders rotate, the upper thorax rotates slightly, and now we chop the handle down to the opposite knee. So we're shifting the weight over and the arms chop down. Shift back, chop down. Shift back, chop down. And if you notice, there's no change in my head and neck and or TPC alignment throughout the pattern. So I'm teaching my core muscles to control this alignment and control the rotation of that cable, pulling me back towards the origin of the machine. So I'm going to set myself up again. Head and neck in proper alignment. TPC, that thorax stacked over top the pelvis. I take a nice athletic, wide stance. I'm going to make sure I maintain this alignment. Grab the handle with my outside hand, wrap the other hand around, bring it to in front of my chest. Make sure I can maintain that position in the static hold first. Now I do my weight shift back towards the machine and chop down. Weight shift, chop down. So maintaining this alignment, my three-dimensional breathing, and the control of my TPC, control of my pelvis, control of my lower extremity throughout the pattern. The weight is not controlling me. I control the weight so that this pattern reinforces all the mechanics that we want to create. Because remember, clients generally will develop structural low back pain when they've lost or compromised alignment, breathing, and control. So all our core exercises should reinforce optimal alignment, breathing, and control. So I hope this video served you and helped you understand why so many of our clients and individuals in society are developing structural low back pain. Stay tuned for the next video where we discuss some additional resources for you if you work with clients that have low back pain. This is Dr. Evan Osar with IMI. I'll see you next time.